Well, hello there. This is Mark Ittleman, speech language pathologist, and welcome to the teaching of talking. Today we're going to speak about speech therapy for aphasia, speech therapy for apraxia, and how will you know what your loved one needs as far as therapy is concerned? There are thousands of therapists all over the world who work with aphasia, who work with apraxia. Many of them have methods that are very good and are very helpful. Yet, some of the materials that are out there for people with aphasia and apraxia may not be useful. So, what are you to do? How are you to know just what exactly to do? You want to do your diligence so that you can get help for your loved one, but you have to tread very carefully because there's just a limited amount of methodologies out there, methods. There are limited amounts of therapists that are out there. So you have to make these decisions very carefully. Okay, so, every week I get a note from somebody that says, will your program help me do this? Will your program help me do this? And, there are a lot of people out there who are wondering, will apps help the person with aphasia? Will apps help the people with apraxia? Will the teaching of talking method help those with apraxia or aphasia? So there are different approaches out there. So I want to just kind of review a few of them with you so that you'll be a more educated consumer in terms of what you need to do. Okay, so the first thing that's really necessary, and it's not something that you may want to do, but you've got to have a good diagnosis for what the problem is. All right? So people are asking me if this will help or if this will help, and I have no idea what some of the problems are that their loved ones have. So I can't make any kind of decision about what will be helpful or what won't be helpful without knowing specifically what's happening with the person. Now, in the field of art, one person can look at a piece of art and have an impression about it, and another person can look at it and they have a totally opposite impression. Well, in terms of the diagnosis for aphasia and apraxia, many there could be many differences how people and even therapists interpret the results of testing. So here's the thing I want you to really, really understand, and that is you have to know what's going on with the person's communication ability before you recommend anything. Before you recommend any type of therapy, you've got to know what's going on with them. And to know what's going on with them, you have to find a therapist who's an expert. A therapist who can sit down and talk with the individual who's got apraxia or aphasia and figure out what's going on with them and what would be the best path to the recovery of speaking. So that's number one, the diagnosis. I would get more than one impression. I would get more than one assessment so that you really have an idea what's going on and there's no doubt in your mind. And the only way that you're going to really know what's going on with your person with aphasia or apraxia is if you contact an expert speech language pathologist, and you sit down with that speech language pathologist and your loved one and have that speech language pathologist assess your person with aphasia or apraxia. Then have the speech pathologist explain to you what's going on. Because let's face it, aphasia and apraxia are very complex speaking difficulties. And an expert speech language pathologist can assess your loved one, and not only assess them, but they can help you understand what exactly needs to be done. Because if you have an expert, they can break a very complex problem down to very simple fundamentals that you can understand. The key to a person recovering speech and language, there are a number of them. One of them is that they have a loved one at home who helps. Although it's not always necessary, it sure is helpful. And number two is an understanding of what needs to be done. And so many people have no idea what needs to be done. And they can buy this, and they can buy that, and they can buy this, and they can buy that, without really knowing the diagnosis and knowing the best pathway forward. That an expert speech language pathologist can help you understand what the problem is and how to go about treating it. Okay. The next thing is that for those of you who have loved ones with aphasia or apraxia, the reason why you need to know exactly what the problem is so that you can find a therapist and find a method that will work to help them. Now, there are lots of people who get speech therapy for various difficulties, but there are some that are exceptional. Some are good, some are exceptional. You want to find the exceptional methods. And the only way you're going to find the exceptional methods is if you know what the problem is and you have an expert who can guide you through the understanding of that problem and then guide you through the methods or the steps to help that person speak again. I think what's happened is that a lot of people with aphasia or apraxia or their loved ones think that, all you have to do is buy an app or buy a program or buy a workbook or something like that, and that's going to help. Well, it often it doesn't, because you don't really understand what the problem is, number one. And number two, you don't understand necessarily the best methods to employ to help that person talk. And, another one of the difficulties and the challenges of caregivers and their loved ones is that they really don't know what the best method is to help their loved ones speak at home. They just don't know. So they have to have somebody who's worked with this kind of problem for years and knows the approaches that'll work. You can't apply an app or a notebook or whatever it is to an individual who's got aphasia or apraxia, because sometimes you have both. Sometimes you have both apraxia and aphasia. And if you have both apraxia and aphasia, there's a method to employ for an individual with both of those problems. And the only person who will really understand that and know the ins and outs is an expert who's worked with both of those problems. So in this particular video, I want to caution you not to go out half-cocked and get this or get that or get this or get that. First, make sure you understand what's happening with them, number one. And number two, make sure that you sit down with an expert and have the expert show you how your loved one can improve talking with some specific methods. Because once you see that a person can succeed, especially your loved one, you'll want to get help, and you'll want to get help right away. So that's as far as I'm going to go on this today. Just very briefly, you've got to know what the diagnosis is, and you've got to understand the diagnosis of aphasia or apraxia. And if you have an expert, that expert can break such a complex problem down to very simple concepts so that you'll understand. You know, almost everything that's really complex in life can really be broken down to simple principles. And many of those principles can be simply taught. And the problem that had seemed enormous can really seem workable. And you can learn it. And that's another problem that a lot of caregivers, they don't think they can help their loved one. Okay? They don't think they can do that. Well, if they think that, they can't. And then there's a problem because maybe there isn't anybody else who could work with them at home. What we do is we train people, loved ones, wives, sons, daughters, friends, to help people with aphasia and apraxia talk. And the best way to do that is to work with an expert who can guide you through the steps of helping a loved one or a friend or a family member talk again. This is Mark Ittleman, speech-language pathologist, thanking you for stopping by. And we hope you have a great day today, a great week, a great month. We ask you to give us a thumbs up if you like this particular video and to subscribe to our channel. Within this particular video, if you click on the title, it'll open up and it'll show you some links. So if you want a free consultation with me, or if you want to find out more about aphasia or apraxia, we have books that can help you understand it. But again, the best thing to do is to work with an expert who will help you understand what you're dealing with and then teach you how to help your loved one at home. So have a great day today. Have a great year. Don't forget the thumbs up, and we'll see you soon. Bye-bye now.